From Kalamazoo, direct to you, it's a WKZO.com quickcast.
Hi, my name is Michelle Searle, and I'd like to speak as a business owner, a single parent, and also as a person who owns a counseling agency, Choices for Change, which is approximately 20 years old. We've been providers for mental health for 12 years, community mental health. And about 2 months ago, received a letter in the mail that said that all general funding clients will no longer receive mental health treatment. That is 35 people at our agency. In order to qualify for general funding for mental health, you had to have been hospitalized this past year. That means that 35 people at just our agency, I'm sure it's upwards of 300 or 400 or 500 people, are going to be no longer receiving treatment. Or in our case, our intern is taking some of them, who is really not qualified to work with people that are that severe. And in addition to that, you're looking at people who are actually going to cost the system more money if you want to look at it from a financial base, because when they are in treatment in outpatient mental health, there is a far less likelihood they will be hospitalized. Hospitalization costs a lot more than outpatient mental health treatment. I think we need health care nationalized now. And it is really a travesty of justice that these people who severely need mental health treatment will be denied it either in a couple months, now depending on how severe, really severe people are in the first place, that we can convince mental health. And this is not mental health's fault, this is a lack of money. Community mental health in Kalamazoo is actually pretty good for what they have to work with. Second, I'd like to talk as a single parent. My health care rates went up $80 a month starting September 1st. That's $1,000 a year, or 30%. I have no health care problems, and for myself and my daughter, I have to pay $350 a month. I have a friend whose daughter has diabetes. She's in business. She pays $2,000 a month for herself, her husband, and her 2 kids. That's way more than my house payment. And I think we have to look at the reality of things, that what happens if you don't have treatment? What happens when you get denied treatment and you have cancer and you can't get any normal, healthy treatment that you would get if you worked for an employer? I think you also have to look at the fact that for me, since I am a single person applying for mental health, if I were to attempt to harm myself, it is not covered. If I could not get mental health treatment if I want it covered, because they don't give that for single people applying, not through group insurance. There is tons of exclusions, and you're very limited. And if you have any health problems, your insurance rates shoot up dramatically. $330 is very low for myself and my daughter, and it would have been $400, but I switched my health care when I saw that rates. But I could do that because I don't have health problems. But if I did, I would be in really severe trouble. And I think those are the issues that need to be looked at. Myself and my daughter are having a German exchange student. So how long? Okay, are having a German exchange student, and we're going to really learn this year about the German program for mental health. And I want to say that we need health care now, because people should not be denied mental health treatment. They shouldn't be denied treatment for cancer.
10 seconds.
Thank you very much.
Okay.